Ptosis is a medical terminology for droopy eyelids wherein one or both the eyes is slightly at a lower level from the normal. It can occur in one eye or it can occur in both the eyes. Ptosis basically happens because of poor function of the muscle that is involved in lifting the eyelid. So the muscle that helps in lifting the eyelid, we call it as levator palpebrae superioris. In short, we call it as LPS. So this muscle is very important in lifting the eyelid. Any abnormality in this muscle can lead to droopy eyelids. Ptosis can be either congenital or acquired. In congenital variety, the ptosis is present from birth. In acquired variety, the ptosis develops later in the life. Among the acquired variety, the ptosis can develop because of either trauma or injury to the nerve that supplies the LPS muscle. But most commonly in adults, the ptosis develops because of slippage of the muscle that is important in lifting the eyelid. We call it as aponeurotic ptosis. In this case, the muscle is slightly receded backwards, resulting in poor lifting of the eyelid. So proper planning is very important. For a proper evaluation of the ptosis is very important, because each type of ptosis will have a different line of management. Each severity of ptosis will have a different type of surgery. In kids who have severe ptosis that is obstructing the visual axis can lead to lazy eye. So in such cases, we advise for early surgery so that the visual system is developing properly and also to prevent lazy eye. In adults, it's a fairly simple procedure wherein in most of the cases the muscle is slightly receded backwards. We make a small nick in the skin of the eyelid, we identify the muscle and we reattach to the normal position, giving a good eyelid symmetry. In adults, in some cases, there will be excess skin, so we remove an excess skin that provides a very good outcome of the symmetry of both the eyelids. So ptosis surgery is very safe and effective procedure with minimal risks involved. It can be done under general anesthesia in kids, and in adults, preferably we do it under local anesthesia.